and welcome to another edition of the Scenic View podcast. We got what has become somewhat of a normal crew in here for us, the usual group. I'm Jonathan Owens, the Communications Director here at Scenic, alongside Artis Watkins, Executive Director, Suzanne Beasley, the Government Relations Director, and Sam Klein, our Digital Communications Specialist / podcast producer. How are you folks doing this morning?
Great.
We're doing well.
Finally warmed up.
I feel like we need to tell people when we're recording because a few times we'll say like today or yesterday. So we're recording on Thursday, January 9th. And with things changing so fast, at least you'll know when we're recording.
On what would have been the ceremonial inaugural weekend.
But the weather had other plans, we found out last night, right?
It's going to be cold, maybe icy.
Governor Josh Stein announced that much of his, I guess all of his inaugural.
The whole shebang, all the events,
the block party,
the ball. Are they going to reschedule or?
They said the ball would probably be rescheduled for the spring.
This happened once before, I remember. I think it was maybe.
Well, we've had lots of things happen. We've had COVID.
Yeah.
And there has been a winter weather event.
I remember that a few years back.
I feel like whenever we get a winter weather event, it always falls near MLK Junior Day.
I think it's a common time for, because I think of things in terms of basketball games, and it's always around the NC State game, the Carolina, which is this weekend. 2 state universities will be facing off on the hardwood, but it's always either the state or the Duke game. So we have DOT crews out salting the roads and getting ready for this weekend's weather event. Do you think it'll be enough to make a snowman?
I doubt that. And we don't usually get the nice fluffy snow, even when it snows enough. There's always ice in the mix, so, it's not good snowman.
Lots of memories of making really pitiful snowmen out of a half-inch of ice when I was younger. So anyway, so we're going to move on to the top.
Wait a minute. Okay. The DOT guys out there and ladies, it's not just guys out there for DOT, to be clear, so I apologize. But the DOT folks working the roads, it's a thankless job on a good day, but considering the vacancies they have in some of the maintenance yards and some of the places that are so vital to keeping our roads open and safe, and especially those secondary roads.
Yeah, and they're still busy up in the West trying to rebuild a lot of roads, too.
Absolutely.
They've made a lot of progress from what I understand, but there's so much damage up there.
I wonder if you can even build roads while there's snow, while you're...
Oh, that's true.
So maybe they have to slow down that operation, but...
It's a lot of roads.
It's a lot of roads.
But yeah, so hats off to the folks at DOT, and be safe. We're thinking of you. I know that's not, you have our thoughts and prayers, but you need better pay. We're going to work on that too.
Heck yeah.
Speaking of pay, everything that we do.
Well, you have to pay for life. Yeah. So everything does come back to, can you pay?
So this episode will focus a lot on healthcare, the state health plan, and just healthcare in general. If you're not a state employee and you found us somehow, just keep listening because we're gonna talk about the whole shebang, if you will. We're gonna talk about the whole system and just how it relates to state employees and retirees in North Carolina as well. But I think that they're experiencing a lot of the same problems everyone is with healthcare in North America.
If you don't know a state employee, you're not a state employee, you don't even know one, you're not related to one, and you think, why do I care what happens in the state health plan? We'll tell you why. The state health plan is about 8% of the market for healthcare in North Carolina. So as goes the state health plan, pretty much so go your costs. And as John said, it's a nationwide problem. The American healthcare crisis is one of our own making by allowing absolutely no holds barred, taking advantage of the citizens. And we've been fighting this issue for years. It does seem to be getting more and more attention from the public, I think, because we've gone beyond the breaking point where too much of people's wages is taken. So we're going to talk about the state health plan, but understand anything that's happening there will affect your health care.
And kind of the impetus for this discussion is the story this week from the Carolina Public Press that the new state treasurer, Brad Briner, wasted little time when he got into office. A week after taking the oath, he's already talking about raising premiums for state employees. We will kind of delve into that issue first, I guess. As you said, the state health plan covers about 8% of the state's
the folks who
citizens.
Who have health care in this state.
Yeah. About 743,000 people total, 256,000 of them are retirees. So it's not just state employees, it's state employee families, dependents. A huge swath of North Carolina is affected by this plan and by the decision of whether or not to raise premiums and out-of-pocket costs. So what were your takeaways? Did you expect him to come out this soon calling for a premium increase?
Well, I think the article's kind of unclear about what Treasurer Briner at the end of the day is going to suggest. We don't know that yet. We don't know how much he wants to come out of the pockets of state employees, but I think his statements are kind of clear. That's where they're going to look. But without putting words in his mouth, because I don't know what his plan's going to be, he did say he will have a plan to revamp the way we do things. It will not be Treasurer Falwell's plan. What will it be? I don't know. But when the headline says uncomfortable things are necessary to fix the North Carolina health plan, new treasurer says. Uncomfortable for whom, right?
Yeah. Well, I guess maybe we should back up and point out what the main topic is, that there's a $507 million debt in the state health plan right now, according to this article. And that's expected
fall
to increase.
Of 2026.
Yeah. And Briner's comment was the expectation that the General Assembly can or should fix this problem is not based in reality. We are going to have to do a number of uncomfortable things with a $507 million shortfall. The uncomfortable pieces are now inevitable. The obvious one is premiums. Those have been held flat for a decade, and I commend Treasurer Falwell for focusing on that. But unfortunately, it's time that we keep up with inflation.
That sticks with me because state employees are already running 9% below market in salary.
Okay. The issue I take with that statement, it's time that we keep up with inflation. The only fact we have about the health plan, because remember, these are secret contracts. And these days it's super, super unpopular and talked about a lot because of the efforts that Elon Musk and Vivek Ramaswamy and others, the Doge efforts. And on the state level, folks wanting the state auditor to look at the money that's going to be spent under Governor Stein's watch on hurricane relief. Why is no one concerned that these are secret contracts between the insurance company for the health plan and the providers? Because the only piece of information we have comes from Siegel Consulting that works for the plan and said, hey, the range of what providers, meaning hospitals or doctors, is paid can go from anywhere as low as 80-90% of Medicare reimbursement as a reference point to 800+%. So if we're talking about keeping up with inflation, we have way overcompensated very clearly, according to Siegel, a good number, or I don't know how many, actually nobody knows how many providers. So how can you come to the employees for anything until you know exactly which providers are getting what? Shouldn't that be your obvious first uncomfortable conversation?
Yeah. And this should be a concern for taxpayers.
Yeah. It should be.
You don't know
There's
what
just no oversight.
Paying for.
It's the Wild West. That's been our argument for, 2 decades now.
Since I've been here.
It used to be you couldn't even see the third-party administrator, so the insurance company contract. Couldn't even see that. We had to fight tooth and nail to make that open. Well, that only tells you what you're paying them. It doesn't tell you what they negotiate literally on your behalf.
Right.
So the state's paying it, but this third party's negotiating it. Taxpayers should want to know. Again, not only is it taxpayer money, but at the end of the day, if they negotiate prices that stink for the consumer, taxpayers are getting hit not only in their tax money that goes to the health plan, but they're getting hit because their prices are going to go up.
Yeah. And costs in North Carolina are especially bad. Forbes had a study, 2024, I guess we'll call that last year now, that North Carolina ranks as the most expensive state in the country for health care.
Yeah.
Another study said that our performance and what we're getting for that is among the bottom of the nation. So
crazy.
That's consistent. That wasn't just last year. I mean, we've consistently for a while now been the expensive place for healthcare and the place where the outcomes aren't considered the best in the nation. What we do have is a lot of places to get it. So we rank pretty high in a pretty good way on availability of healthcare. But availability just means there's a place there you can go to. Can you afford it? Is it going to bankrupt you?
Yeah.
That's a whole other question. So these are the things that, again, I am astounded that people who are concerned about transparency and about monitoring public nickels and dimes and dollars are not keyed in on this mess, because that's where the big, big money is, y'all. And back to the statement that you asked about, a specific statement, that asking the General Assembly to fix it is just not based in reality. So let's talk reality. The reality of this situation is we do need $500 million to make this fund whole by fall of 2026. So that's 2 budget cycles. The state health plan, though, is still owed $323 million that the legislature got specifically from the federal government to pay for state health plan costs. They gave some of it, but $323 million of it never made it to the state health plan. So that's
a hole.
That's 323 of that $500 million. And then more importantly, these staff vacancies we keep talking about. The Office of State Budget and Management in August of 23, so it's gotten a larger number by then. But in 23, the Office of State Budget and Management said over $1 billion had been put in the reserves because of vacancies, because of staff vacancies. What does that mean? Over $1 billion got put in North Carolina's reserves because state employees were doing the job of more than one person and trying to provide the public services taxpayers expect. Taxpayers have no idea there's all these vacancies. So if you look at the $323 million still owed for COVID, the $1.17 that went into reserves at least by 2023 because of vacancies, you're looking at about $1.5 billion that went in the state's coffers or stayed in the state's coffers. So $1.5 billion roughly, is still held by the General Assembly of money that would have gone to state employees, $323 million of it specifically designated for the health plan. So to think it's not reality to go to folks who keep holding state health plan money, and I get it, the General Assembly's got a hard job. They're trying to make everything work. And you know what? That $1.17 billion plus that went into reserves, that sure was needed after the storm. But the bottom line is, let's be honest about where it came from. Those reserves didn't come from just, hey, everybody made great decisions. No, state employees were doing the work of more than one person.
And to not seek that money and instead go try to get that money from, state employees who already don't make what their private sector counterparts make and are suffering under inflation. It just seems wrong to me.
See, I'm confused because if the General Assembly and the state received so much money for pandemic relief and it hasn't been paid back to the state health plan, who else are we supposed to go to for that money?
Right. Well, traditionally, the idea is in politics, you go to the path of least resistance. And the fact of the matter is, if you were to try to go to the healthcare industry, again, we don't know what we're paying them. We just know the range. The range tells us we're wildly overpaying some of them. But rather than go to the ones that are being wildly overpaid and say, we're not going to do that anymore, or all of y'all have to take a cut of some kind because it's got to be, quote, uncomfortable for everybody. That's a really resistant path. They have, and good on them, they've got a really organized, deeply, deeply funded lobby.
They do.
And I think that's the source of not only state employees and retirees, but the whole country's frustration.
Against
with that.
Right. Americans are fed up.
Yeah.
Hey, Donald Trump agrees with us on this in terms of drug prices. Mm-hmm.
I'm not sure he knows what he was.
Well, no, I mean, he had said things in his previous term that indicated on pharmaceutical pricing, which is a big piece of the health plan problem, the health care problem in this country. But he had been critical of why are we spending more than other countries. Obviously, President Biden had been the same page. So you've got two very wildly different men, different presidents who are on the same page with why are we doing this?
I think that's just a little tangent, but I think that's it is why Trump is so popular with everyday people is sometimes he does just step out of line and say things like that no one has told him that the corporation wants you to say this. So please, sometimes he does take a stand that usually gets tracked back a little bit. But
so I agree. And that's one of the reasons I don't think it's not reality to go to the legislature. I know, Suzanne, you surely have had conversations with legislators in the North Carolina General Assembly who say this isn't right. They're not comfortable with it. They're not comfortable with going to state employees or anyone else in their community that makes working folk wages and asking them to pay more, knowing full well that we're not going and asking anyone else to sacrifice ever, ever, ever. They're uncomfortable with that themselves. So they know. Yeah, we're having a lot of conversations. There's a growing amount of dissension over just looking the other way.
And it's on a national level, too.
I think everyone would appreciate someone standing up for
the bottom line, I think you may have said this already, though, but if it's affecting the state health plan in North Carolina, it's going to affect everybody else's insurance at some point and the country. So,
and I know, we've had some really good conversations with Senator Berger and his staff in the past that gave me great hope. Obviously, we've not closed that deal because they've still got an awful lot of the money that should go to the health plan. Now, do they have it anymore? No, probably not.
Yeah.
But does that mean, then we have to go to the employees? No.
Not at all.
The piece of this that doesn't get talked about is the piece that's holding all the money. That's the industry.
Have we seen any projections for surplus this year, or if there will be one? I know we've talked about there'll be a lot of strings on it with the the hurricane relief and
I
whatnot.
don't see how you have a surplus in this situation. That's great if we do. But look, everything is always on the table.
Mm-hmm.
And tax cuts are great. But tax cuts, no matter how great you make them, probably never put back the amount of money that those increased healthcare costs on everybody.
Okay.
So if you're losing more and more of your wages to healthcare and your taxes go down a little bit, are you better off? The priorities I think are going to be re-examined by the General Assembly. Yeah.
I've done a lot of surface level research this week trying to find out more about this topic. And what I found is North Carolinians pay about 14% of their income on premiums and deductibles right now. And that's up from 11% in 2008, and it's steadily increasing. And that's a percent. So that's not like...
And that's North Carolinians. That's
North
not
Carolinians,
just the state health plan.
And that's all North Carolina, not just state employees. So 14% of your salary is a large... that's twice what you pay in taxes, right? The state taxes, at least.
Oh, it's
and
more
state
than
employees
that.
are making 9% under market. So...
Right.
So if you think about it, 14% of your income is going to healthcare costs. In 2025, the state income tax rate is 4.25%. So that's 3 times what the tax rate is. In 2026, that's going down to 3.9%. There's a amendment on the table right now to set it at 5% capped, right? So this is a way bigger spend for families than even your tax rate. And people get so mad about taxes, And,
It's like, look over here. Look at the taxes.
Yeah.
They're killing you. And
no, healthcare is killing you.
Yeah, exactly.
It's not that
healthcare is killing you. But I think that more and more people are starting to understand that. And that's why I do think you will see some changes if not in this year, in the next few years in the General Assembly. I think people are going back home, and more people, more constituents, more people on the campaign trail are saying, look, this is killing me.
Mm-hmm. And, you don't get a lot out of you obviously get a promise of paying health care costs whenever you have a problem, but at least with taxes, you're getting like roads to drive on and prisons to keep you safe.
And we've always fought the public perception of state employees and public services and what the general public thinks they're getting for their tax dollars. A lot of them just don't understand all the services that are provided by state employees. Right. But if they were not there, and if there's not money to fill vacancies and, something to entice more employees, public services suffer.
So, listeners, we warned you before you started this podcast that we're going to go on some tangents.
We're going deep, and
there will be some tangents, but we think it's important. Obviously, we're impassioned about this. And you should be too. So, where do you see this fight going then?
So to wrap it up, Treasurer Briner, we said it at the beginning of when he first was about to take office. Look, he's going into a terrible situation, but he has to figure out how he addresses it. We don't know exactly what he's going to do yet, so we can't judge what he's done because he hadn't done it yet. The only thing we know is his public comments in the last week, and those are not great.
Mm-hmm.
There hadn't been one word about going to the industry for anything. I'm hopeful he will indeed say, look, I hear what the entire nation's saying.
Right.
That, multi-million-dollar CEOs' salaries for these hospitals and all of these things we've talked about before in terms of spa-like birthing facilities and stuff like that, that this is not okay when we're talking about going to some of the state's lowest paid folks and asking them to give even more of their hard-earned dollars for healthcare. So we got to give him a minute to figure out what he wants to do. But we have to be clear from the beginning. It's not fair to him if we don't make it clear that our folks, because our phones did ring off the hook after this article came out, people telling us exactly what we would expect. We've talked about healthcare a lot over the last 10 years here. So it's not surprising that people call us and said, I hope y'all are doing something about that mess right now. So we are.
And honestly, it's kind of like anytime you take a new job or a new adventure in your life, I'm sure he goes into office and he sees this terrible debt coming up and he wants to react and fix that problem. And I commend that. Yeah. But he also needs to realize the largeness of the system and how much power he has.
Yeah.
And
I think that, I've made the offer to him and also for Thomas Friedman, the executive administrator of the plan, that they're welcome to come on this podcast because we're not going to just talk about them. We would love to have them be able to have their voice at the table and say, what y'all aren't thinking about is X, Y, and Z. Let's have that discussion. I think discussions are what has to happen. They have to happen in the General Assembly.
Yeah. We may not know everything about the situation, and I
cannot imagine it, but yes.
I mean, that's totally not the case, right? But I think that Treasurer Falwell even didn't realize at first that he represents 10% of the state's health.
Commercially insured people, yes.
Yeah, and that's huge power.
It's huge power.
So,
it's insane.
So he can affect change. He can
affect change.
He can make pharmaceutical companies squirm. He can. So I think that maybe he's just got to gain his footing and.
Yeah. And we'll give him a minute for that.
Yeah.
Look forward to talking with him.
He's a personable man. Another thing that changed in the state health plan was the new administrator took over on January 1st. Aetna has now taken the reins of the state health plan over from Blue Cross Blue Shield. We've seen a little response from some employees who've had some issues, not a wave of problems yet, but as we were talking, it's early, right? People aren't even using their healthcare.
I mean, it's a massive plan. Anytime an employer switches over a health plan, period, I don't care the size of the employer, you're going to have some hiccups. But with this size plan, you would think there'd be a fair number. But our phones, like you said, it's early. Our phones are not ringing about that right now.
So have we said
healthcare is so frustrating. In
Tell
general.
us a little bit about that, Sam.
Well, I have underlying conditions that affect my body in drastic ways. I skip most of my appointments for that. I have the medications that I need in case it messes up, and there's certain appointments that I'm supposed to do every 6 months, once a year. There are so many issues within healthcare that I'm like, I'm not going to get blood work every 6 months when the company that my blood work goes to tells me, hey, you didn't pay the $30 you owe us. And I'm like, I paid it 2 months ago. And they're like, we didn't get it. And so I have to pay a second time, only to get one of those eventually refunded after another 4 months.
So you're saying...
And then also just some of the cost of these appointments. I can't afford to go get an ultrasound every single year.
There's the big thing.
It's $800 for me to get an ultrasound with my insurance. I can't afford to do that every single year when I have other doctor's appointments that I have to make.
Well, I think therein lies the problem. Healthcare is out of reach for people who need healthcare.
One of my friends... We were talking about last night.
Perfectly put.
One of my friends, one of my really good friends, her family member had a lot of medical bills, and another family was covering those for her and could not afford to take herself to the doctor. And by time that family member had passed away and she was no longer covering those medical bills and she went to the doctor, she found out she was in stage 4 cancer.
Oh my God.
Because she
was not taking care of herself because she had to take care of this family member because that family member could not afford to take care of her own medical bills.
So many sad situations.
Goodness.
It is. And I think that, we're going to try on this podcast to have more experts around the table because, we said it jokingly, but none of us are healthcare experts. Unfortunately, we've had to learn more about the healthcare system and how it affects employees than we ever had wanted to. But we need some experts around the table and we need some policymakers around the table. So somebody from the General Assembly to talk about healthcare and what they're doing or, what their plans are for this year would be really big.
Yeah, I find myself kind of in the same mindset as everyone on this. I'm no expert on this, and it just seems from the outside looking in that healthcare is something everyone needs, and the people who provide it know that, and can charge what they want to for it. And I think everyone just feels kind of helpless, kind of powerless, and that's where SEANC comes in.
We're not powerless.
It feels anxiety-inducing.
Well, of course it is.
Every time I have to schedule a doctor's appointment for anything, I'm like, how much is this going to cost me?
Yeah.
Yeah.
It could be
and you have insurance. What if you didn't have insurance?
It could be a general appointment, and I'm still sitting there.
Okay,
I'm like, how much
that's a question. When you think to yourself, how much is this going to cost me? Do you call and ask them, how much is this going to cost me ahead of getting the treatment?
I'll usually look through the papers that I have and be like, okay, how much do they pay? How much this is typically cost? And I have a mom who works in healthcare. She's a nurse. So I'll usually contact her and be like, how much do you think this is going to run me?
And the reason I ask is because, of course, that was the big issue that Treasurer Falwell was obsessed with, was the fact that you could call different places within a 10-mile radius in a big city and get prices that were very wildly different for the same procedure. But we don't
do that.
We don't know what it's going to cost us. But he always pointed out in the grocery store, we wouldn't go up to the cash register unclear about what the can of peas is going to cost.
Yeah.
We
But
would
also-
never accept that price on the can of peas.
Sometimes if you have to go to a specific doctor, they'll only give a referral to certain places for you to get something else done. That
That's
they
right.
say, oh, you need a follow-up test. We don't do that here. We'll send your referral. And they don't necessarily give you a choice on where your referral is sent
because
to
they
say,
probably own the
hey.
place they're sending you to.
Yeah.
That's the bottom line this day. More and more and more.
And we're on a tangent right now, but
Big tangent.
Another thing.
But insurance companies, they've negotiated whatever this test or procedure is going to cost, and the cash price of that may be completely different. So you see all that connection with, providers, hospitals.
Gets a problem when you can save money by not
Yeah,
using your
by
insurance.
not using your insurance. That's crazy.
And this is a really, it's really deep,
on,
but
tangent
it's
on.
really deep, and maybe this will stay in. But when things are this complicated and this huge, you need government to step in and regulate, especially the healthcare industry.
Well, I mean, it's the Wild West right now.
It is.
Yeah.
So again, let's see what Treasurer Briner's wanting to do. Let's see what the legislature says about it. Because obviously, it doesn't sound like Treasurer Briner wants to ask them to, the General Assembly being them, to bridge any of this $500 million gap. But we're certainly
We
asking
do.
them. Yeah.
Yeah.
We need the treasurer to ask them, to be clear.
That would be huge.
And if I'm the legislature, I am probably going to say, I'm not doing that, but y'all need to go, where the deep pockets are. But the legislature has to say, we're fine with the secrecy being taken away from these contracts. The legislature does have to do that. They don't have to come up with $500 million, but they have to say, we will not stand in the way of making these things transparent so the public knows what tax dollars are being used in what way on this healthcare.
So if he won't go to the General Assembly and ask for that funding, maybe he'll go and ask for raises to make up for those premium increases.
That perpetuates the cycle. At some point, we do need raises, but raises to make up for the overpriced healthcare just keeps it going, right?
Doesn't change anything.
because then they start raising healthcare again.
Mm-hmm.
And then they're like,
If you
okay,
don't get the raise the next year, your healthcare's still gone up.
I guess that's how inflation happens, right?
Yeah.
Oh, what a topic.
Yeah.
The healthcare in we're now 3 hours into this
Yeah,
podcast.
right.
Remember the SpongeBob thing? It's like 3 hours later. And
Yeah.
we're
Here we
still
are.
talking.
Well, if you are a state employee, we are probably going to be putting together, I would imagine, some town halls on this issue around healthcare. And so
Yeah.
we will be able to hear from you. And
Look
that's
forward
the
to
most
that.
important thing.
I have a question. How does this happen? So what needs to happen? I guess the Board of Trustees will have to make a decision on increasing premiums, correct?
On what they will recommend.
To
Yeah.
the
And
General Assembly.
what's the timing on something like that? Do they just,
So it's usually the January meeting
okay.
where they make those kind of decisions. I'm not sure, y'all, what the specific date of the meeting will be. It's not posted on the website yet, but it's generally at the end of January. But yeah, that's where they make those decisions, which technically doesn't change anything there, but that's
Yeah.
what they recommend to the General Assembly to make their decisions on. So it's really important that the trustees.
So would the
Take this
premium
to-
increase have to be approved by the legislature is it in the
It would
budget?
be appropriated in the budget. yeah.
Okay.
Anything that has to do with state health plan, retirement system, it all has to come through budget and be appropriated.
And usually that means that if there is a premium increase, that would happen next year, January 1. So you would see increased costs in January. We have a year, not a year. We have about 15
Yeah.
days to talk about it. But we will still be advocating at the legislature regardless
Always.
of that. Stay tuned to this issue. Speaking of the legislature, they did come back this week for one day. Just
one day
swearing in. So we have a new legislature that came in.
we do.
What are some of the changes?
So leadership changed in the House. a couple of things in the Senate, but the House, they obviously have a new Speaker of the House. Former Rules Chair Destin Hall, Representative Destin Hall, is now Mr. Speaker. Majority Leader John Bell is now Mr. Chairman of the Rules Committee. Representative Mitchell Setzer, who's been a great friend to SEANC, is now the Speaker Pro Tem. He unseated Sarah Stevens for that position. Reeves remains the minority leader. In the Senate, not a lot changed. The biggest thing, I think, is Sidney Batch is now the minority leader. Senator Blue is no longer going to take that spot.
Some of our officers made it down to the legislature yesterday for the swearing in. I saw some pictures with some of those folks you just mentioned, right?
Yeah, and I'm sure we've got a lot more to go through. Sam came down and with the camera, and we had such a good day yesterday. First Vice President Wendell Powell, Second Vice President Emily Jones, and our General Treasurer Stacey Crabtree joined the team on the ground, and we just really got to talk to so many people yesterday, from Senator Berger on down to some of the newbies at the General Assembly. I love opening day because it's happy. Nobody's getting mad at each other yet. It's very ceremonial, the swearing in, and lots of family members are there. So that's kind of fun too, to have legislators introduce you to their family members. And
was Lieutenant Governor Rachel Hunt there?
She presided, yeah.
Did the governor come over?
I did not see him if he did.
I remember one year.
I did not see him.
Yeah, I remember one year. I remember seeing him over there on swearing in day.
That doesn't mean he wasn't there. I just didn't see him. But I did run into Senator Tom Tillis.
Okay.
Former Representative Beverly Earl, who's one of my favorite people. Former Senator Floyd McKissick, who's just an amazing human being. I was really happy to see him. And then, all of our old friends. We made some new friends yesterday, just got familiar with faces, which still will take a little time because there are a lot of new faces. But it was a great day. I was tickled to have, some of our officers on the ground. That's always important to have that presence. And I think it's always important for legislators to hear directly from our people, specifically the folks who are leading this organization. So we had a great day yesterday. I'm looking forward to anyone else that wants to come and join us at the legislature during session and speak to your lawmakers. We'll hook you up. Love to have you on the ground with us.
And you say they'll come back
January 28th. January 28th.
And really get down to business.
That's when we get down to business.
What are you expecting this year? Is it going to be a quick session or a long?
Oh, I think it'll be long.
Okay.
Look, I've gotten over expecting short sessions. So this past short session, which, given they didn't agree on anything and just cut the rope and went home, that's the first short session we've had in some time. So I just don't expect anything short. I go ahead and set my sights on it being long, and then I'm pleasantly surprised when it ends.
Any other topics we need to get to?
Oh, I don't think we have time for any more topics.
Yes, we've probably podcasted people out today.
Well, in honor of this, we've already talked about the DOT workers, and
yes,
everyone needs to be safe going to, we have employees who will get to the job no matter what.
Lots of essential folks who are going to get to the job.
We always remember the employee who rode to the prison on his lawnmower.
He sure did. Right. He sure did, and got to that prison despite the weather. And I wish the public knew more about that kind of effort people make. And they do that so that their coworkers aren't left in the lurch.
Mm-hmm. There are also a lot of college students about to go back to school this weekend and traveling. Please be safe in the possible snow. Please pay attention.
Yeah. Maybe that's the big thing. Pay attention, y'all. Here in North Carolina, when it snows, we all lose our minds.
Speaking of snow, go ahead.
I saw something funny that said the scariest part about driving in snow isn't the road conditions. It's the fact that you can't see the lanes. So everyone is basically out here playing Mario Kart.
It is true.
Frogger.
But stay home if you can.
Yes.
Eat lots of breads and
get that bread and milk
and just get fat and happy.
You know what I was talking about. Okay, so our question of the week.
John's wacky weird question of the week.
In keeping with the snow talk, what is your best snow memory? Sam, you got to have something going to Western Carolina. Probably slid down a hill, right?
I didn't do that much when it was snowing at Western. I had my dog and he did not he actually loved the snow. I took him outside and he played in the dog park for 3 hours. And
that's always fun.
When I came back inside, I had to wash him because he was covered in mud and snow and it was disgusting. But I think my favorite snow memories were growing up when I lived in Tennessee. We would get snow almost every year and me and my brother would grab our little, essentially trash can lids and be like, let's go sledding. Go out there, play all day, make some snowmen, and then come back inside and Mom would have hot chocolate ready to go.
What's it been, 4 years since we got to get snow?
At least.
A long time.
I think I was a
Long
senior in
time.
college last time I experienced
Mine's-
snow.
What about you, Suzanne?
Snow cream.
Oh, yeah, snow cream. Don't eat the yellow snow cream.
Don't eat the yellow. Don't eat the yellow snow.
Speaking
and,
of
you know,
dogs outside.
like I said earlier, we don't usually get that pretty white fluffy snow here, so you can't make snow cream with sleet and snow. That doesn't work.
Hey,
Yeah.
but the
But snow
ground might
cream,
be cold enough to do it this time.
maybe.
Hopefully.
Because I think
I also
it'll
have
actually stick.
like a little doggy story, like Sam's talking about her dog. But I had to say goodbye to Lily, little dachshund, miniature dachshund. She was my girl, but it snowed years ago. She was 13 when I put her down, so it's been 10 years ago at least. And we had snow. Was it 10 years ago? Anyway, there was enough snow that when I put her outside, she sunk.
Oh,
So yeah, we had to dig out some yard space to accommodate her situation.
how about you, artists?
Moving to North Carolina when I was 12 from Texas, just seeing the snow was
Yeah.
so magical. And then friends got together my first Christmas and bought me a sled.
Oh, nice.
And, but had to teach me to sled. 'cause,
Right.
A flexible flyer. But there were so many memories around that I thought those are just going to be my best memories forever. But teaching kids to sled, that's what I'll never.
Oh.
Yeah.
And I think that's easier to remember because at least we have video of that, as opposed to back in the day. But yeah,
And
sledding.
you have the most awesome place
yeah.
where you live.
I live one block, one street over from probably the best hill in town for it.
Wow.
We had one of those hills in Tennessee that was a hill that my dad would say every time we'd go out there. If you're going to be dumb, you got to be tough. Good luck.
Feel like on Christmas vacation when he
Like
sprays the
Yes.
stuff out there. So mine is, my dad and I were just talking about this last night, which is why I brought up the question. Do y'all remember in 2000 when we had that gigantic snow?
I
Yes.
do.
Oh, man. And
That's my least favorite snow memory because I was shoveling
it was so...
off
so much
part of my
snow.
roof in Durham so it didn't cave in.
It was like
literally.
two
I
foot
don't
of
remember
snow.
that.
Shut everything down.
How old were you then?
2000?
Yeah.
I was born 3 months prior.
Oh, you don't remember. But so we were laughing because my dad was like, you remember when that happened a week before the meteorologist in Greensboro was like, oh, nothing's going to happen, right? Nothing's going to happen. It's just going to be a little snow. And then it happened. And the guy, the first episode back was like, anyone looking for a meteorologist? I need a new job. But our power didn't go out. And we lived like
Wow.
out in the rural
Mhm.
country. And all my friends' power went out. So like everybody came to my house. It was pretty awesome.
That
We
would
had
be
an
a pretty
awesome
epic
time.
memory.
Yeah. and I
Snow
was-
parties. Woo-hoo.
Yeah.
I
So-
also didn't even live in North Carolina at the time. We lived in Yuma, Arizona, so I guarantee you
So
we
no
were
snow
not
there, right?
we were not getting
Oh, yeah.
snow.
It was unbelievable.
I
But
think that's probably the biggest snow. I mean, obviously
Yeah,
that I
I
can
think so.
remember.
oh yeah,
I
think they
remember
called
a
it
pretty
100
good
years
Yeah.
ago.
one.
Yeah.
In 2011, I had just moved to North Carolina, and my parents told me, they were like, don't expect a lot of snow. Don't expect to get snow living here. And that winter, we had just moved there in that winter. Huge snowstorm in January.
That was the
And
one.
we were outside playing all day.
That was the one where the infamous picture of the Beltline, was it Beltway or line? What do you
Was
call
it Glenwood?
Yeah, where
Glenwood,
the car's on
Yes,
fire.
the car's
on the
on
phone.
fire.
That was
That's so
epic.
funny.
Epic.
Okay, there's our snow tangent. Snow.
Well, thanks everyone for joining us. If you're still on here, God bless you. And we will be back next week with an even awesomer episode. Thank you.
Awesomer. Stay safe. Stay warm.